We would like to begin by acknowledging the peoples of the Kulin Nation, the traditional custodians of the land that we are speaking to you from today. We also acknowledge the traditional custodians of the land on which each of you are living, learning, and working from today. We pay respects to their elders past, present, and emerging. We would like to also warn Aboriginal and Torres Strait Islander viewers that this presentation and any corresponding documents may contain images, voices, and names of deceased persons. Good evening and welcome back to Topics We Should Be Talking About. Tonight we discuss the diabetes epidemic amongst Aboriginal and Torres Strait Islander people in Victoria. Diabetes is the world's fastest growing chronic disease and if left undiagnosed or poorly managed can lead to a number of serious, life-threatening illness. The two most common forms of diabetes are type 1 and type 2. Type 2 diabetes in particular is reaching epidemic proportions globally and in Australia. The greatest burden falling on socially disadvantaged and Indigenous peoples. In fact, diabetes was the second leading cause of death for Aboriginal and Torres Strait Islander people in 2018. In the ABS 2019 Health Survey, it was estimated that around 7.9%, which is just over 64,000 Indigenous Australians had diabetes. That means that they are 3 times more likely to have diabetes than non-Indigenous Australians. There was also a higher reported population of diabetes amongst Indigenous people who lived in regional or remote areas. So why is this? Well, the risk of developing diabetes is influenced not only by an individual's behaviour, but also by historical, social, cultural, geographical and economic factors, as government health policies and services. Now, for Aboriginal and Torres Strait Islander people, there are a broad range of historical, social and cultural determinants that influence their health. Health disadvantages experienced by Aboriginal and Torres Strait Islanders are historical in origin. So to understand the impact of diabetes on Indigenous people, it is necessary to understand the historical, social and cultural context of Indigenous people's health. Having maintained a hunter-gatherer lifestyle up until the 18th century, colonisation led to major changes in lifestyle. The adverse changes in physical activity and nutrition, key risk factors in diabetes, played an important role in the development of the disease. The first case of diabetes amongst Indigenous people in Australia was in Adelaide in 1923, and studies have found a significant correlation between the forced development of a westernised lifestyle and the levels of diabetes in the Indigenous population. So in today's society, with economic opportunity, physical infrastructure and social conditions influencing the health of individuals and communities, Indigenous people continue to suffer with substantial disadvantages as a direct result of colonisation. Now currently there's no known way to prevent type 1 diabetes, but the prevention of type 2 diabetes is a critical component to care. The main health risk factors that influence the development of type 2 diabetes are obesity, a sedentary lifestyle, and an unhealthy diet. These health risk factors are prevalent amongst Aboriginal and Torres Strait Islander people, especially young adolescents. And the ABS 2012-13 Health Survey comparisons between Indigenous and non-Indigenous Australians among things like obesity, physical activity, and vegetable and fruit intake highlight the need for prevention and management of the diabetes epidemic amongst Indigenous people, without a long-term commitment and funding for resources to deliver programs that are culturally appropriate, sensitively tailored, and not perceived to be being forced upon, that address diabetes across the lifespan. Aboriginal and Torres Strait Islander people will continue to suffer unexpectedly high levels of diabetes. A good example of such a program is that of the Feltman Felt Mum program. When we discussed the program with endocrinologist and Feltman executive Bhupinder Patel, he went on to say this: The Felt-Mum program aims to energise the Victorian Aboriginal workforce, create career pathways, and build the capacity of organisations to provide culturally appropriate services to their clients. Health professionals play an important role for people with diabetes as they are a critical source of medical advice, information and support. Aboriginal and Torres Strait Islander people enjoy quality of life through whole of community, self-determination and individual spiritual, cultural, physical, social and emotional well-being. So what is Feltman? Well, it's a diabetes education tool that was developed by the Victorian Aboriginal Community Controlled Health Organisation, VACCHO, and Diabetes Victoria. Feltman is designed to help health professionals explain diabetes in a way that's easy to understand and can be used by individuals and community groups as a one-way demonstration or as a two-way interactive workshop. As pictured here, the Feltman program comes in 2 available sizes and features a printed fabric human body mat with interactive stick-on attachments, prompt cards, various forms of video instructions and more. The program also has the available add-on of Felt-Mum. Felt-Mum is a diabetes in pregnancy resource that's used in conjunction with the Feltman program and is designed to help health professionals explain diabetes in pregnancy in a way that's easy to understand. The Felt-Mum kit includes a stick-on printed fabric baby, wig, and other pregnancy-related stick-on attachments, prompt cards, various key messages, and an instructional video. In terms of training and education in Victoria, the National Diabetes Service Scheme, NDSS, funds the national rollout of the training resource to provide upskilling and professional development in diabetes to Aboriginal and Torres Strait Islander health workers, practitioners, registered nurses, allied health workers, and those working with Aboriginal and Torres Strait Islander communities and clients. These sessions are run by Aboriginal Liaison Officer Colin Mitchell, along with a diabetic educator nurse. The training sessions are practical and interactive and run for about 6 hours. It includes how to use the Feltman program in order to explain the key messages around prevention and management of diabetes, the difference between type 1, type 2 and gestational diabetes, diabetic retinopathy, and how it affects the eyes, and diabetes as well in pregnancy. The program just sounds like it's got it all, doesn't it? So let's now hear from our health expert reporter Emily Wallace on the success of such programs and why they do or do not work.
Thanks, Alicia. Visual teaching tools are an excellent way to help someone understand content they are engaging with, according to Bobek and Versky. Feltman is such a successful tool in educating Aboriginal peoples because it was developed by the collaboration of VACCHO and Diabetes Victoria. Feltman can appropriately be used to educate Aboriginal peoples because it doesn't compromise self-determination. This program can specifically cater for the population of Aboriginal peoples which are proven to be more vulnerable due to the numerous reasons that stem purely from colonisation. Intergenerational trauma has caused many devastating hardships for Indigenous Australians. Aboriginal peoples have expressed passionately and vulnerably that it has caused them mistrust against authority, according to Isbell et al. How can they trust people educating them on their bodies when those people have contributed to the systemic racism in modern times? When the ignorance of their ancestors are the ones that destroyed the nutritious diet that came from the rich of the land and replaced it with artificial manufactured sustenance and called it food. Aboriginal peoples deserve programs and resources that are created by people who have shared the same experiences and hardships, who share and understand the same determinants that affect their well-being and therefore are able to trust and allow chance for education on their terms. After the Feltman was distributed, an online evaluation study was conducted in which included all who had participated in the use of the product. The results returned with 100% of the respondents confirming the Feltman was appropriate for the use of Aboriginal peoples. They recorded the usefulness of the tool and the success it had in diabetes education, according to Brown et al. This tool is what we need across all VACCHOs, not information which is unspecific to the Aboriginal population. Not information that is clearly developed to be provided to non-Indigenous peoples who have an obvious difference in dietary needs and requirements. No, we need to invest in the Feltman. According to improvement specialist and diabetic educator Brianna Borg. She says, yarning circles and the Feltman are utilised in the aim to address the Aboriginal and Torres Strait Islander peoples around the prevention of diabetes, particularly targeting the population's females aged 13 to 25 years of age, as they experience disproportionately high levels of diabetes. The partnership of yarning circles and the Feltman representations with ACCHOs enables the culture and identity of Aboriginal and Torres Strait Islander peoples to be at the centre of their care. Their perceptions of health encompass the cultural, social, emotional, spiritual and physical aspects of their health in the aim to better assist in educating and improving the overall health of these peoples. The rising prevalence of diabetes among Indigenous females aged 13 to 25 is a result of colonisation. And for decades after, the repercussions linger and affect the Indigenous population as a whole. The utilisation of these lifestyle educational programs have been proven to improve and prevent the occurrence of type 2 diabetes among Indigenous females, leaving a positive impact on their health through the assistance of community-initiated programs such as VACCHO. By targeting the younger generation of females, the education provided becomes a lifelong adjustment in the way that they perceive their health, visually represented to them through the Feltman and addressed within a yarning circle. Please, invest in the Feltman.